The wrist ganglion is a swelling, a bulge, which comes out of the wrist, and we see this in young adults. We also see it in older patients associated with arthritis. However, normally this happens for no real reason. It is a bulge of jelly. It's actually not joint, it's not synovial fluid. This is a bulge of jelly which comes out of the wrist, and it can go up and down in size, and it can interfere with the movement of the wrist and can be problematic. The ways we treat this, if it's going down in size, then reassurance can certainly be enough. Nowadays, we can have these drained or aspirated under ultrasound technique. There's a very high recurrence rate, up to 70%. However, occasionally it can recur, and if it recurs and it's much smaller and doesn't bother the patient, then this can certainly be left alone. The vast majority of wrist ganglions will disappear eventually. It may take years, but they will disappear. The other way of treating this is surgically. These can be surgically excised, either using arthroscopic techniques, keyhole surgery with very small incisions over the back of the wrist, or with an open incision. However, even with surgery for a wrist ganglion, there can be up to 30% recurrence rate. The wrist ganglion is in fact a balloon. If you can imagine a balloon with a valve in it, which is filling up, and the balloon is normally attached to one of the ligaments in the wrist. The ganglion over the back of the wrist is normally from the scapholunate ligament. The ganglion on the other side of the wrist is often attached to the portion of the volar ligaments of the wrist. When one aspirates a ganglion, one is simply emptying the balloon, so the ganglion is still there, and that is why it has such a recurrence rate, because it can just fill up again. When one surgically excises a ganglion, one removes this balloon, this sac of fluid, with its stalk, where it's arising from in the wrist, but even once this is removed, it can still recur. So they are quite tricky. In the fingers, one can have a ganglion at the base of the finger. At the base of the finger, a ganglion. This can interfere with gripping things. And this is a lump of jelly, once again, a sac of jelly on a stalk arising from the sheath of the tendon. But it's not actually attached to the tendon itself. And this can be problematic, and this can be treated with either aspiration or with surgical excision. And these are problematic because they do get in the way.